Hello all, welcome to my channel Physio Guide by Divya. In this video I am going to tell you briefly about human anatomy. So let's start our video. First of all, human anatomy introduction. It is a science which deals with the structure of the human body. Now, subdivision of anatomy. In this, the main subdivision of anatomy is the cadaveric anatomy. It is the study of the dead, preserved bodies. In this, again, this can be done by one of the two approaches. They are the regional anatomy. Regional anatomy means in this the body is studied into parts like upper limb, lower limb, thorax, abdomen, head, neck, brain. And the other approach is the systemic anatomy. Systemic anatomy. In this, the body is studied into systems like skeletal system, muscular system, articular system, vascular system, nervous system, and respiratory, digestive, urogenic, endocrine system. Okay. Now next one is the living anatomy. Living anatomy is studied by inspection like palpation, percussion, auscultation, endoscopy, okay, radiography, electromyography. Next one is the embryology. Embryology is a study of the prenatal development changes in an individual in pregnancy. Next one is the histology. Histology is the study of the structures with the help of the microscope. Next one is the surface anatomy. It is the study of deep parts of the body in relation to the skin surface. For example, like palpating the artery. Next one is the radiographic and the imaging anatomy. It is a study of the bones and the deeper organs by plain and contrast radiography, by ultrasound and the CT scan, computerized tomographic scan. Okay. Next one, comparative anatomy. This is a study of anatomy of the other animals to explain the changes in the forms, structures, function of different parts of the human body. Means comparison. Next one is the physical anthropology. It deals with the external features and measurements of different races and groups of people. Next one is the applied anatomy. Means this deals with the application of the anatomical knowledge to the medical and surgical practice. Next one, experimental anatomy, is the study of the factors which influence and determine the form, structure, function of different parts of the body. Next is genetic, deals with the study of information present in the chromosome. Next we will see about language of anatomy. In this language of anatomy, it deals with the various positions, planes, terms in relation with the various regions and movements. So we will see. Firstly, we will see about the positions. Position, that is the anatomical position. Straight, what will stand straight, no, that is the anatomical position. Next one is the supine position. Supine, lying position. Next, prone, reverse of supine position. Next one, lithotomic position. This is the person lying on her back with legs up and feet supported in the straps. So this position will be like this. Now we'll see about planes. Planes, in this, the body. The plane passing through the center of the body, dividing it into two equal parts, right and left, is called as the sagittal plane. Next one, coronal, means the person standing sidewards like this, sideward looking forwards, and in this it divides the body into anterior and posterior. This is anterior and posterior half is called as the coronal plane. Next, horizontal, means it is divides the body into upper and the lower part, is called horizontal plane. Next one, oblique plane and the cardinal plane. Next, terms related to body movement. In this, movements in general at synovial joints are divided into four main categories. They are gliding movement. In this, in relatively flat surface, moves back and forth and from side to side with respect to one another. In angular movement, in this we'll see flexion, extension, lateral flexion, abduction, adduction. In special movements, like we'll see in pronation, supination, protraction, retraction, inversion, eversion. In rotation, medial rotation, lateral rotation. So now we'll see in detailed in in separately in upper limb, lower limb. In upper limb, we'll see flexion, extension, abduction of shoulder, adduction of shoulder, flexion of shoulder, extension, circumduction, medial rotation of shoulder, lateral rotation of shoulder, supination, pronation, adduction of fingers, abduction, opposition of thumb, circumduction of thumb, flexion of thumb, extension of thumb, abduction of thumb, adduction of thumb, flexion of wrist, extension of wrist, flexion of metacarpophalangeal and interphalangeal joint, extension of metacarpophalangeal and interphalangeal joints. In lower limb, we'll see flexion of thigh, extension of thigh, abduction, adduction, medial rotation, lateral rotation, circumduction, flexion of knee, extension of knee, dorsiflexion of foot, plantar flexion of foot, inversion of foot, eversion of foot. In the neck, we see flexion, extension, lateral flexion, rotation, opening the mouth, closure of mouth, protraction, retraction. In the trunk, we see extension, flexion, lateral rotation. Now we'll see terms used for describing muscles. They are like origin, insertion, belly. Means this is a fleshy and contractile part of the muscle in between belly, tendon, aponeurosis, raphe, ligament. Now terms used for describing vessels. They are arteries, veins, venae commitans, capillaries, sinusoids, anastomosis. The terms used for describing bone features like linear elevation, rounded elevation, sharp elevation, expanded ends of articulation, and small flat area for articulation, depressions, openings. Next we'll see systems of body. Systems of body. The study of anatomy can be divided into following 12 major body systems. These body systems influence one another and work interdependently and independently to maintain health. First one is a respiratory, means pulmonology, consisting of nose, nasopharynx, larynx, trachea, bronchi, bronchioles, alveoli, and diaphragm. Next one is a articular system, arthrology. This comprises of various joints and their ligaments. Next we'll see about a muscular system. Muscular system. It is a system which moves the various joints of the body and is responsible for activity, locomotion, and facial expression. Next is the circular system. Angiology. This comprises of the cardiovascular system, which consisting of the heart and the blood vessels. Next is the lymphatic system, which comprises of various lymph vessels which withdraw excess tissue fluid with macromolecules and filter it through lymph nodes and return it to the venous system. Next we'll see the skeletal system. This comprises of the numerous cartilages and bones which provide support and symmetry of the body. Integumentary system, dermatology, which consisting of the skin with its various appendages like hair, sweat glands, sebaceous glands, and nails. Next, digestive system, gastroenterology, which comprises of the various organs associated with ingestion, mastication, digestion, and absorption of the food components. Next is the urinary system, helps in excretion of liquid waste from the body. This consisting of the kidneys, ureters, urinary bladder, and the urethra. Next is the reproductive system. In this, the andrology in male and gynecology in female, which consisting of the different organs in male and female. Next, endocrine system, which consisting of the ductless glands like hypothalamus, hypophysis cerebri, thyroid, parathyroid, suprarenal gland, and islets of the Langerhans in pancreas, which produce hormones. Okay, they are carried to various target organs via blood. Now, special senses, which include sense of taste, sight, smell, hearing, balance, and touch. Next is the nervous system, neurology, which consisting of billions of neurons included in the central nervous system and peripheral nervous system. Central nervous system, which is brain and the spinal cord. Peripheral nervous system, which is the cranial and the spinal nerves. So I hope you understood. I have briefly explained about this anatomy. Thank you for watching this video.